Okay, the lab for week 5 is going to be all about draping. So during that lab, we do not practice the setups for the competency assessment at all. The draping is a part of the competency assessments, but we just spend time going over the various different types of draping, which is what we are covering in class at the same time. That correlates with that lab. So you'll really want to talk about asepsis associated with draping, making sure that the students understand about cuffing the hands so they're not contaminated, making sure they understand what's sterile about a drape, that it's only sterile to table level, talking about not dropping a drape to the floor and then picking it back up and extending it up to anesthesia. And then also just talking about when we drape things, if we're sterile, we always drape what's in front of us first, what's away from us last. And also just how we drape with other individuals up at the field, and also how it can be the surgical tech who drapes with another surgical tech, or the surgical tech who drapes with the surgeon, or maybe the surgeon and the assistant who are draping, but that it's the surgical technologist's responsibility to go ahead and make sure that we're anticipating the next drape, having them stacked in the order in which they're going to be applied on the back table, with the first sheet that's going to be applied on the top, the last sheet that's going to be applied on the bottom, and handing those items up to the individuals who are actually applying the drapes up at the field. So as you look at this description, you can see that it tells you the various different types of drapes that you'll want to have available. So make sure that you're squaring off, showing the students how to utilize linen or blue towels or non-disposable towels, depending on what you have available in your facility. And then also the paper sticky drapes, or the utility drapes, the paper square offs, and showing them the technique of how to make sure they're not unfolding too low, how to cuff their hands and apply those to the field. Also, you'll want to demonstrate the laparotomy, utilizing a laparotomy sheet, and also the universal sheets and how to apply those. We'll want to do head and neck draping with the split sheet and a head drape sheet, as well as the application of a turban with the cloth towels and a perforating towel clip, if that may be an option that your surgeon would utilize. If at all possible, you want to attempt to apply lithotomy drapes. So hopefully you'll have some stirrups, and if you don't have a mannequin, that's fine. You can at least have the stirrups on the bed, and your students could drape those, applying the under the buttock sheet and then the 2 leggings, as well as the lithotomy sheet that would give access to the vaginal perineal area. If at all possible, you should attempt to show them how to drape pelviscopy as well, where I have a sheet that's going to give me access to the abdomen and the vaginal perineal area, and show them how it's a little bit different than just draping for the lithotomy. Or we would then incorporate possibly squaring off and making sure that that lower square off isn't covering the vaginal perineal area. We'll do upper and lower extremity draping. If you have the option, you may want to show them a hand sheet as well, and then just basic upper and lower extremity, as well as hip draping and shoulder draping, and show them how that's a little bit different in order to give complete full range of motion of those ball and socket types of joints. Please try to show them steri drapes, so IO bands, and then also talk to them about how we do have the clear steri drapes that are available if you have a patient who has an iodophore allergy. Show them the proper application, how the surgeon or the person actually applying the drape will take the writing side and then they will take the paper side, and how to take that without allowing it to drop below a sterile level, and hand that off and not bring it up to the field. So after you get through all of those various different types, then you would go on and do the checkoffs. So there are videos within the Unit 6 for clinical orientation that do demonstrate these various different types of draping. You could have the students watch these videos in lab if you would like to, prior to having them practice how to apply, and then they can use them as a resource as well. So again, I usually demonstrate it and then have the students actually attempt to apply the drapes in the order. And then also just talk to them about arranging the drapes in order of use when setting up the field, so that they're able to anticipate them up to the field, and also so they're having minimal movements with the drapes, so that there's less risk of contamination and less risk of air currents as well. Now for the draping checkoff, which will be again one of those checkoffs back here that was in the same section as the Bookwalter checkoff, the students will just need to drape a laparotomy draping just with 4 square off towels and a laparotomy sheet with you, which is just the basic draping that we will be utilizing for the laparotomy competency assessment. So you just need to watch them apply that, make sure they put it on in the correct order and they're utilizing the correct aseptic principles, and then you'll check them off on that one. And then you'll want to have some cords prepared for a laparoscopic case, and if at all possible for an arthroscopic case too. So you'll want to talk to the students about how we toss off cords for such cases as a lap chole or a lap hernia, making sure that they're positioned for use, handed off in the order in which they're going to be utilized, starting with the insufflation tubing, positioned so that they go off to the video tower, but positioned where they will be used up at the field, and then tucked in the pouch of a lap chole or a laparoscopic sheet. And then show them, make sure that they understand which end is getting tossed off, which end is kept up on the field. Talk to them, about not dropping it off and giving too much away, that it's always better to keep too much rather than to toss too much off, because you could always give more away, but you can't pull it back up onto the field. Just watching their hands, making sure they're not getting too high, too low, reaching behind them. Talk about tossing it off to the circulator, especially the suction irrigator, where you don't want to toss it on the ground because it has that spike which is going to be spiking into a sterile bag. Make sure that that's handed off to a circulating nurse. On the arthroscopy, again, making sure that they run everything off the unoperative side. Everything goes to the foot of the bed as kind of a guide of how much to keep on the field. Again, tossing those off in the order which they're going to be used, starting with the inflow and the outflow, and then going to the camera and the light cord, and then a shaver or any other accessory items that they might have. Clipping those up on the field, running off that unoperative side. So attaching the cords for a knee scope. And then, clipping the pouch on the other side if you are utilizing an arthroscopy drape that does have that pouch that isn't secured on the side. And then if you have it available to you and it's something that you do in your facility, you may want to practice with the students about tossing the cords off a Mayo stand for like a shoulder scope case, where the Mayo stand is going to be brought in from the unoperative side. So tossing those off and then securing them to the Mayo stand cover itself with the towel clip rather than where they'll be actually attached to the patient. So just talking to them about that, maybe coiling them, talking about not running over the fiber optic light cord with the Mayo stand, how much to keep on the field, how much to toss off, those kinds of things. And again, making sure that they're attached in the order in which they're going to be utilized up on the field. So again, you'll check your student off, sign and date on those checkoff sheets, and then go ahead and keep those in the progression notebook, and then we'll turn those in at the end of the course and keep those in the student's permanent file.